to the Pathways to Positive Futures webinar for June 2nd, 2015, Addressing Homelessness Among Youth Aging Out of Foster Care, a Social Networks Approach. I'm John Osowski, Dissemination Manager for Pathways RTC, and I'd like to go over a few announcements before we begin today's session. For best results, please check the settings in your audio pane if you're experiencing any audio problems. During the presentation, you can send us questions using the chat feature, but these will be held until the end. We've made sure that we're planning time to answer your questions at the very end. Also, please note that this webinar will be recorded and posted to our website within a few hours of the webinar's completion. Our URL is shown on the slide below. That's pathwaysrtc.pdx.edu, and you'd find our previous webinars page. And now I'd like to spend a little bit of time introducing our panelists for today. We have Jennifer Blakeslee with us, Shannon Turner, and Jessica Schmidt will be joining us shortly. And I'd just like the panelists to say a few words about themselves. So Jennifer, would you start us off?
Sure. Hi, everybody. Thanks for joining us today. I'm Jennifer Blakeslee. I'm a research assistant professor here at the Regional Research Institute at Portland State University School of Social Work. My research career has generally been focused on youth aging out of care with a particular interest in social network analysis and network-based approaches to thinking about assessment and intervention. So that's the impetus for our conversation today, and then looking particularly at how social network perspectives might illuminate ways that foster youth end up experiencing homelessness as an outcome.
Hello, everyone. Thanks for joining us. I'm Shannon Turner. I'm a licensed clinical social worker and a research associate at the Regional Research Institute. I'm a project manager for Futures, where our focus, again, we focus on young people from foster care and supporting them through high school and college as well. And I'm also an alumna of foster care in California, and so that kind of leads my passion, and this is why foster care and improving supports is my passion.
Great, and it looks like Jessica will be joining us just shortly, so we'll have her say a few words when she gets here. But did you want to get started with our content today?
Yeah, let's go ahead and get started.
Okay.
So first, we're just going to give a broad outline of foster youth outcomes. We know probably most of you in the audience have familiarity with this issue and familiarity with homelessness in particular as an outcome for youth. But just a quick overview for those who aren't familiar. Each year, approximately 20,000 youth age out of the foster care system, about 7% of those currently in care. And we know from the research that there are negative outcomes associated with being in foster care and particularly with aging out of the foster care system. You'll see on your slide that we have a few of those outcomes listed related to employment and education, earnings and self-sufficiency, criminal justice involvement, early parenting, substance abuse, and of particular interest today, as many as 40% of youth who have foster care experience have experienced homelessness in young adulthood. So we can go to the next slide. So what are the risks associated with young adult homelessness? Why are we interested in this outcome in particular? When any young person becomes homeless, they face a number of serious adverse outcomes, including trauma experiences, suicide attempts, victimization of many kinds, exposure to sexually transmitted diseases, gang involvement, and early mortality. So the outcomes that this group faces, these are worst-case scenarios, but the path into and through homelessness experiences and housing instability can be unpredictable. So when we are thinking about youth aging out of care, that's a significant failure of the system to prevent what could be serious outcomes for this population. So we have a number of regional and state findings that tell us that former foster youth are more at risk for experiencing homelessness. So overall, nationally, about 30% of homeless adults report having any foster care histories. And that's compared to 4% of the general public who would report having foster care experience. So similar to when we look at the numbers of adults, young adults in particular, who are involved in the criminal justice system, there's an overrepresentation of people in this service system who had previously had involvement in the child welfare system. Looking at a couple studies in particular, we know that 22% of the study participants in the Northwest Foster Care Alumni Study had been homeless for at least one day within 1 year of leaving care. Some state numbers, 36% in Nevada, 28% in Maryland, and 37% of former foster youth aged 19 to 20 in Massachusetts had been homeless at some point since age 18. So 37% within a very short period of time are experiencing significant housing instability and or actual homelessness. So in California, they looked at all the youth that were aging out of care and assessed the availability of safe and affordable housing for them, and had 65% could not report that they were already connected as they aged out of care to safe and affordable housing for themselves. In Portland, Oregon, where I am, our most recent estimates for looking at youth who were accessing the homeless and youth runaway system and had experience in foster care, 40% of those youth that were accessing homeless and runaway youth services had also reported being in care at some point, whether in Oregon or in another state. And then also in Portland, we're going to be telling you some numbers from the My Life study, which is intervention research that's been conducted for many years now here at the Regional Research Associate with principal investigators Sarah Geenan and Lori Powers. And Shannon and Jessica and myself, so all three of your presenters today, have had some connection to the My Life studies. And currently we're doing a follow-up with youth who are 19 to 21 who experienced foster care involvement, and many of them were in special education as well, and received the My Life intervention for youth in care back when they were 16 or 17. So we've got some particular follow-up findings for them that we pulled for our presentation today. And so far, for those who had left care in the My Life study, nearly a quarter are saying that they didn't know where they would live when they exited care. 21% had at least one episode of being homeless within 12 months of leaving care, with an average of 5 episodes, so 5 experiences of housing instability, so moving into and out of housing stability. And average nights homeless reported by those youth was 69 nights on average in the last 12 months. So that's 19 to 21-year-olds who within 1 year of leaving care. So the numbers are significant and very concerning. So looking next at our next slide, we're going to talk about, well, what do we know in general leads to youth homelessness? So for any youth in general who are experiencing this. We know the former foster youth are more at risk, and looking at those pathways into homelessness, we find that they're similar in many ways to what is known about youth in general, that it usually comes down to family problems and economic and residential instability. I've got a quote there on the slide that I included because I really like how these researchers framed it, that talking about homeless and runaway youth in general, they've been pushed or thrown from homes because of family problems, such as family violence or substance abuse, family conflict, and disagreements with caretakers about adolescent behavior. And I imagine for many of those in the audience who have experience with youth in foster care and are familiar with placement and instability for those youth, that this quote probably sounds pretty familiar with what you've seen many youth experience, even in foster homes. And then there's also the connection between the fact that many youth are in foster care because they were pushed or thrown from their homes due to family conflict. So we've got those two things going on. We've got foster youth who may have come into care because of these dynamics, and then we've got foster youth who may be experiencing placement instability while in care because of these same dynamics. So conflicts in foster placements, in group homes, that are similar to this description of family violence, and disagreement with caretakers about adolescent behavior. And then we know that there's a connection with LGBTQ youth being thrown or pushed from their homes, whether we're talking about youth who have transitioned into the foster care system because of not being safe because of their sexual or gender identity, or youth who are in the homeless and runaway youth systems for that reason, leaving their family of origin. And then there is the additional risk for LGBTQ youth of experiencing family conflict in foster homes due to their identity. So that's something that those youth experience with every new foster placement, that there is a risk for them to be rejected and for that placement to disrupt because of their sexual or gender identity. And something else to consider when thinking about LGBTQ youth in particular, and we've included a link with a fact sheet that will be available in the PowerPoint so you can find out more information. But something to consider is the lower potential for those conflicts to be resolved in the case of adult rejection of youth identity. So whether they're exiting homes of origin or exiting foster placements, those are conflicts. If it's come to the point where the youth is leaving the home, then those are less likely to be resolved. But what we know about homeless and runaway youth in general is that many of them do maintain home-based friendships and home-based ties to family, if not their parents, then with other relatives that they're still close to. And we know from work from researchers Johnson, Whitbeck, and Hoyt had an article in 2005 that clarified that youth who identify as gay, lesbian, or bisexual are less likely to maintain those ties to home-based friendships and relatives, as are youth who experience caretaker abuse prior to leaving home. So they're also less likely to maintain those parents and family ties. So we can imagine that LGBTQ youth in particular, and or any foster youth who experienced abuse by a caretaker, whether that was a foster caretaker or family of origin, these youth have less support to fall back on. So if they are experiencing housing instability, if they are experiencing life on the street or living in shelters, they don't have that home base, and there's less likely to have a conflict, a family conflict that can potentially be resolved so that they could return home. And importantly, Burrs and Rose and Curtis did a fascinating study where they statistically analyzed whether the likelihood of former foster youth to experience homelessness was more due to their background. So they compared youth with similar backgrounds on a number of factors versus those with those same factors who had been in foster care, and found that former foster youth were still more likely to experience homelessness, housing instability, poor neighborhood quality, and reliance on public assistance. So we know that foster placement seems to be a unique risk factor. And for example, from our most recent My Life follow-up data collection, we're finding that for our youth who are out of foster care, 52% report having moved at least once in the last 12 months, with an average of 2.75 moves in the 12 months since leaving care. So even for youth that may not be homeless in terms of living in a shelter or living on the street, we're seeing very prevalent housing instability for this group. And a salient example of how this might be particularly due to foster care experiences is the housing insecurity experienced by those who are attending college, who may, for example, be doing well otherwise, but need to move into unstable living situations with biofamily, or stay in their cars over the summer or holiday breaks because they didn't have access to the dorms. So that's a really salient example of how foster care experiences in particular can lead to outcomes like housing instability and homelessness in some cases.
On that, this is Shannon. I just want to add, for futures, we are actually, this is the first study in Oregon that we're studying young people from foster care coming into their freshman year at Portland State University who have lived experience in foster care as well as lived experience with mental health stressors. And I can say overall, out to recruit supports and such across campus, the one stark resource that needs the most attention, it seems, is the lack of housing. So we still don't know where these young people are going to end up during breaks or summer or holidays. And we also know during those times, especially dealing with mental health stressors, mental health stressors are heightened during those times just because of what comes with not knowing where you're going to go and not having anybody to go home to. So just wanted to add that because it's definitely, housing is a problem, and I believe only, I don't have the stats right in front of me, but there's really only a few states in colleges actually that have addressed that situation.
Thank you, Shannon. So next up, looking at foster youth about to age out. So taking a few steps back and saying, what do we know about those who are in care and are about to age out? We all have access to the Midwest study, the Midwest evaluation of the functioning of former foster youth, which has provided a great deal of really seminal information about this population. They started collecting data with 732 youth in foster care aged 16 to 17 in 3 states in the Midwest, And they followed up that data collection at age 19, at age 21, at age 23 and 24, at age 26. So we have a lot of really helpful data available about this population and what's leading to different outcomes. And at age 19, they followed up with those they'd done baseline measurement with at 16 and 17 to look at which youth were more likely to have experienced homelessness, and found a number of factors that seemed to make sense. That youth had run away more than once while in care, that they were in a group care setting at baseline when data was first collected, so they potentially aged out of that group care setting, had experienced physical abuse, delinquent behaviors, and importantly, did not feel very close to a biological parent or grandparent. And this is the first of a few findings we're going to look at, suggesting that maintaining close relationships with some family members or family-like members may provide a preventative effect on homelessness. And we've also included a link to a recent preview of a United Way report coming out of King County, Washington. I don't believe the report is available yet, but if you know otherwise, please let us know in the chat or in the Q&A period. But they have initially reported preliminary findings, finding similar predictors of homelessness, multiple placements, frequent school changes, disrupted adoptions, etc. So looking on our next slide, as the youth get older, so the Midwest study has been able to tell us that 24% of those aged 23 and 24 had ever been homeless. And the Midwest study is defining homelessness as sleeping in a place where people weren't meant to sleep, sleeping in a homeless shelter, or not having a regular residence in which to sleep. And found similar risk factors, again, with running away while in care, placement instability, physical abuse, delinquent behaviors, mental health disorder. And then in particular, there was a study in New York City in 2004 that looked at the records of youth and young adults who had accessed the public shelter system and compared that to child welfare records. So in this case, we're looking at a definition of homelessness that is very specific, public shelter usage. And they found that 19% of former child welfare service users had accessed the public shelter system within 10 years of leaving care. And that they were more likely to, if they had been in foster placements as opposed to receiving in-home preventative services, so they were removed from the home, highest, again, if they ran away from care, or exited to independent living. So we're seeing the pattern over and over again that there's a particular group of foster youth aging out that is more likely to experience homelessness in their move into young adulthood. And there's a succinct quote I like from Curry and Abrams, did a very recent article, 2015. I believe it was in Children and Youth Services Review. I might have that journal wrong. But they say very well what I think the essence of the problem is. The incidence of homelessness and housing instability among aged-out foster youth may be associated with a lack of reliable, extended familial support, which has become an increasingly important resource for many young adults well into their 20s. So looking at our next slide, explanatory theories. So why do we think foster youth in particular are vulnerable to homeless? Park and colleagues presented a couple, and they make a lot of sense, and we won't go into depth into those, but the first is that they're simply poorly prepared for independent living. Any of us who have worked with this population understands that they can struggle to finish school, to have employment experience, to make living arrangements, and in many cases, those arrangements might be with relatives who they may or may not have stable and healthy relationships with, and that there are unstable conditions potentially in the family of origin which led to child welfare involvement in the first place. And that Park surmises that the experiences these youth have in their family of origin and in the child welfare system may make them more vulnerable to psychosocial problems that impact their ability to get and maintain stable housing. I think both of those are true. But there's a third perspective that we'll be working from today that has informed the work that I've done with this population in my research, and it's informed by a number of other researchers that we'll be touching on. And that's the child welfare involvement uniquely hinders protective social network functions that could alleviate some of the psychosocial and other impacts experienced by youth due to family of origin challenges and the experience of being in care. So these functions include social support, or social capital is another way to talk about it, and we'll be referring to different types of social capital. And as we move further into the presentation, we'll talk about how this understanding of social network functionality can help inform how we design interventions from a network perspective to work with these youth. And one thing I want to say, just talking about the social network functionality, and to sort of pause for a minute and jump in here, Shannon, if you'd like, that in some cases the definitions of homelessness that we're using may seem pretty broad, and the incidence rates may not seem that striking. But for all of us here in Portland and those of you in the webinar audience, if you ask yourself if this is something that you or someone you've been close to has ever experienced, for some of you I know the answer will be yes, and I think that you probably have a deeper understanding of some of the issues we're talking about today if you have had that experience. But for most of us who are studying this issue, there are probably stable family relationships, longtime friends, even generous coworkers or acquaintances that have the capacity to take us in the case of an emergency or in the case of significant family conflict or sudden job loss or another economic crisis. And we may not have even actively worked to maintain these relationships as we transitioned into young adulthood and beyond. These relationships just were, and more importantly, perhaps, it's because they were never disrupted. And when we think about child welfare involvement, we're talking about this significant disruption of social networks due to a number of systemic issues that have nothing to do with the youth in themselves. So court mandates on what kind of relationships are going to be allowed for the youth versus not. Systemic issues around the availability of good foster homes. So we sometimes have backward incentive to maintain foster parents instead of maintaining foster youth in placement. So we might move a youth because we want that foster parent to continue to provide parenting for other youth, and that may not be the best for the youth themselves. We've got issues like caseworker turnover. We've got issues like contract compliance that are regulating service availability and eligibility. We've got federal funding streams and state funding streams and county funding streams, caseload size. I just want to take a moment to sort of think about all of these systemic issues that are impacting from the youth perspective their social network of support and the ability of the people in their lives to maintain positive, supportive relationships with them as they move into foster care and eventually out of foster care. So going to the next slide, let's think about foster youth support networks for a minute. As we just talked about, we're talking about disrupted family and community relationships in many cases, and long-term placement or placement instability, group homes, a number of different ways that we can imagine social networks might be disrupted, resulting in sparse networks, disengagement from services on the part of the youth, problem behaviors, social adjustment, fewer positive relationships, and overall lower support capacity of the network of people surrounding the youth, whether those are informal or formal supports. And I do want to say, remembering that child welfare intervention is intended to strengthen support through a combination of formal family-based services and the development or continuation of existing informal support from kin and others in a way that improves youth well-being and long-term outcomes. That's the whole point of child welfare intervention, and in many cases that happens. And I don't want to discount the fact that in many cases youth do have positive experiences in care and do move on to good outcomes. And there's a study from Tom Keller, who's one of our colleagues here at the PSU School of Social Work, that he did it with colleagues in 2007, that looked back at those Midwest study youth at age 16 and 17, and he developed profiles, statistical profiles based on a number of different factors, trying to see whether we could sort of group different kinds of youth who had similar experiences. And he found that 38% of youth fell into a group he called competent and connected. And those youth had experienced placement stability, so often being placed with relatives. They felt they had many supportive relationships. They were experiencing early success in education and employment. These were the kinds of youth who were also more likely to say that they thought that being in child welfare and being placed in foster care was the best thing for them, or that they would be open to reaching out to social workers for continued help after they aged out of care. So we've got a large subgroup that had good experiences and potentially experience less network disruption. On the other hand, oh, sorry, go ahead, Shannon.
I just wanted to add, I guess, from my experience as a youth coach, I was a youth coach for the My Life Project for 4 years, where I would have a small load of youth and meet with them once a week for 1 year. We worked intensively together for a year, and we utilized an intervention called Take Charge, with relationship building being the most important, and focused on self-determination and tapping into that self-determination. And I know from my personal experience working with youth, the youth that I worked with that were in foster care but placed with family members very much speak to what Jen and what Tom have found. It just seemed they had a better sense of belonging. They felt like they had a purpose, and they had a better understanding of why they were in care. And it seems to be because they did have the stability in relationships and people around them that could be there and support their understanding of why they were in care, and perhaps why there was restrictiveness around why they couldn't see certain family members. They also had more access, I noticed, more access to social media, more access to phones, more access to technology, more access to reaching out to those that perhaps they couldn't see face-to-face, but they had other ways to see them. When I worked with youth that were placed in care into group homes or just mandated in terms of strict restrictions around not seeing their bio family members and such, I can say from just experience and listening to them and supporting them that there was a lack of sense of belonging, interruption, and what their identity was, and really a sense that they did not have a purpose. Why am I even here? What am I supposed to do? I don't have a connection to this foster parent. I don't have connections to these people in my group home. I know that my parents have done this, A, B, and C, but I want to be with them because I love them and they love me. So I just wanted to kind of support Jen's conversation and just that experience of listening to these young people and really witnessing the difference between working with young people who were in foster care in very different ways.
Thanks, Shannon. I think that really highlights the difference between these two subgroups. So there was an even larger subgroup, 43%, that Keller called distressed and disconnected, that had been experiencing placement instability. They reported relatively low social support and service engagement and few attachments to supportive adults. And that's really the group that we're talking about that is more at risk for homelessness and in general is potentially harder to intervene on their networks. And one of the ways, so if we go to the next slide, one of the ways we've considered these issues in the research literature is just looking at social support in terms of youth perceived social support. So we've talked about the concept of a social network, and lots of researchers have talked about that, and we all intuitively know what that means. We know what we're talking about. But generally, our way of measuring it has been asking youth whether they perceive that support is available in terms of different functions. So do you have someone to help you if you're sick? You know, no, none of the time, usually, most of the time, all of the time. So questions like that. So if we look at some of the studies looking at that measure of perceived social support, they tell us that in general youth do feel supported, which in terms of coping is good news. I'm glad to know, as someone who cares about this population, that foster youth feel supported most of the time on average. We see that social support is associated with well-being and life satisfaction. And across the board, when you look at the Midwest study findings, at each wave, youth consistently report, on average for the entire group, feeling support is available almost most of the time. So then the numbers, the mean is just under what would be the mean for them answering most of the time. And even in that distressed and disconnected group from Keller's study, they still had relatively high social support scores. And we've got some mixed findings of social support in predicting outcomes. So in some cases, it's not, the relationship isn't as direct as we might expect, that youth who feel supported would be doing better. Alternatively, Greason and colleagues in 2005, they just published this article, asked youth how many people they had providing different kinds of support, and they found that support declined over time for all the youth in their study, and it was an evaluation of social support provision for youth who are participating in a large life skills-oriented ILP program, an independent living program for foster youth. And regardless of other factors, they saw that support did go down over time and wasn't connected to whether they participated in that life skills ILP. And Greason and colleagues have a quote that I like that tells us sort of where the field is at, from my understanding, in terms of social support. And that is this: how older youth in foster care define, make sense of, and use social support, how programs and interventions can best facilitate and support it, and how researchers operationalize it are questions that remain unanswered. I think that's where we're at. So if we know that social support matters, and we know that general perceptions of support don't tell us much in terms of intervention, how do we measure social support in a way that tells us what to do differently, potentially, in designing interventions in general and designing interventions for individual youth that we work with? It's that sort of frame of reference that is how I came to think about these issues from a social network perspective. So thinking about social network perspective for a moment, it's a shift in how we think about social support and how we think about the context of social support provision. So it's different from measuring perceived social support. A social network perspective says that we're interested in the youth and all of their relationships, and not just their individual relationships with these people, but whether those people also have relationships between each other. Does their social network look like a web, or is it sparsely connected? So if we take a social network perspective, we're very systematically measuring those direct and indirect ties between a set of people identified by the youth. Personal network analysis is a branch of the broader field of social network analysis, which is huge and we won't go into, but it's been used in many different disciplines. It's been less used in social work, and it's kind of an outgrowth or an extension of ego mapping or genograms or the work that historically the field has done with clients to talk about the people in their lives and the support they're receiving. But if we do measure a network systematically, we can then look at patterns in those networks. So structural patterns as far as how large those networks are, how interconnected they are. The measure of network density is an important measure of cohesion in a network. Are the relationships in that network likely to stay connected to each other? We're interested in network composition. So what's the range of attributes of the people in the network? So what social groups are they from? Are they friends? Are they family members? Are they people from school or work? Are they service providers? Are they parental roles? We're interested in that range of support that can be provided by different kinds of people. And we're looking for diversity of social roles in those networks. We don't want them to have just one kind of person in their life. We want them to have friends, service providers, parental figures, relatives, a range of resources, someone to mentor them, someone to be their job coach in their brand new job, so things like that. We're also looking at relational characteristics. What's the strength of each of those relationships? And we can measure that in a number of ways. The way that I've approached it is frequency of communication, closeness, however that's defined by the youth, whether they feel close to that person, and how long they've known that person. And then the content of the interaction of that relationship. I've looked at social support, looking at the classic emotional, concrete, and informational support, whether they receive those different kinds of support in different domains. But there's a number of different kinds of ways you could approach that. So in layman's terms, if we're looking at indicators of support in a youth support environment, we're wanting to know how many people are supportive. Do they know each other? Are they from different social spheres like family and school? And are those relationships close and or stable? And do they provide more than one kind of support? Because the research does show that multidimensional support provided through a single relationship is more likely to be a lasting relationship. So it's something we want to encourage is for the people in youth lives to provide a range of different kinds of support if possible. So So I want to pause for a minute because we've been joined by Jessica Schmidt and give her a moment to introduce herself.
Hello, everyone. I believe John introduced me in sort of my professional role here at the RI, but I'm also a former DSS caseworker and foster parent to transitioning youth in care.
Thanks, Jessica. Okay, so looking at our next slide, what does network intervention look like? We're going to breeze through this a little bit because we know we're presenting a lot of information today and we want to make sure we have room for Q&A at the end. This is just a brief description of a pilot intervention I did at New Avenues for Youth, which is a homeless and runaway youth serving program here in Portland. And they, a few years ago, wanted to take a more upstream perspective because they were noticing that many of the youth that they were serving had foster care experience. So what we did was design an intervention specifically using a social network perspective. We are treating the network as the client, so we work directly with youth, but we're focused on all of the people that the youth identify in their network. And in many cases, we're having conversations with those people with the permission of the youth about the network and about how the network as a whole can better support youth. We're focused on building two kinds of social capital, and it's something I would really want to stress that there are these two kinds because I think it's a very intuitive concept, and once people get it, it's very helpful in thinking about interventions with youth. So two kinds of social capital. First is bonding capital. So it's strong and interconnected long-term relationships. They tend to be densely connected. They tend to provide everyday emotional and concrete support. These relationships are built over time. You can also call this permanency or family. It's what we imagine when we think of family or family-like network. It's the kind of support and communication we don't even think about that's happening every day. And then bridging capital, these relationships tend to, the support provided, when you get bridging capital, it's usually through less close relationships. They might be shorter term relationships. Service providers would often fall in this category, although after a number of years they may be also providing bonding capital. These are instrumental connections. They often provide informational support as needed. So if you imagine a youth network, we would want them to have both kinds of support. We would want a dense core of regular communication, providing daily support, and then also these bridging ties to other networks that can be used when needed to connect youth to services, to connect them to unfamiliar social environments that might be mentor-rich environments, new experiences for them. So when we're designing an intervention, we can sort of focus on both of these things, whether these two kinds of capital exist in networks and whether we can do anything to facilitate those relationships. This kind of intervention begins and ends with network assessment. So we want to know whether the work that we're doing adds new connections, whether it maintains or strengthens connections, whether we're able to create interconnections among members so they can communicate with each other about support that's being provided to youth. And on our next slide, this is just a simple example of what a network map might look like. It's a very simple method to capture network size, composition, and interconnectedness. And we've got a quick example of just this is what one might look like. So this is an example from a youth we worked with in the program who very helpfully just used initials. So it's confidential information. We can't tell who this youth is or what they're talking about. And from this we can gather network size just by counting the number of connections. Network density, I don't know if it'll be clear on your screens, but the youth has drawn connections between the people that also know each other, so we can use that to calculate density of the network for research purposes. And then composition and diversity. We can look at the range of different quadrants that they named people. So this is just one example of a way that you can approach it. It's how I approached it in my work so far. And then the next slide is an example just of what can be called a relationship grid. A lot of these tools were designed from work that Tracy and Whitaker did in 1990. They created, I believe it's called the Social Network Mapping Grid, and I sort of adapted those for my purposes with youth aging out of foster care. But this grid, they delineate the individual relationships, the kinds of support they're getting through those relationships, and how strong those relationships are along the dimensions that we talked about earlier. And we've got a quick example of just what one looks like when it's filled out. So youth are circling the different kinds of support they get in the various realms. And from that, we can get their overall relationship strength. And we can also just get sort of a snapshot vision of what kinds of support they're currently receiving. And next up, we're just looking at network intervention activities. So we've created a fidelity tool for this intervention to try to really ground the activities in network theory. So we can always go back and ask ourselves whether what we're doing is likely to change the network in some way, so that when we measure it the second time, we can see that we've created relationships, or we've strengthened relationships, or we've added interconnections between people. And the activities fall within those sort of theoretical categories for how we would want to see a network change, as far as identifying new bonding or bridging sources of support, expanding support capacity in terms of bridging capital, and a number of examples you'll see there for what that might look like. Increasing network cohesion through bonding capital. So are we strengthening relationships? Are we interconnecting people? And then just a lot of what we do is just working on relationship skills with youth, talking to them about relationships, about networks, how to be network savvy, how to find mentors, how to resolve conflict with people in their lives, so that they can have for themselves sort of this cognitive snapshot of what their network looks like. The goal for the program is that for any youth exiting the program, that they would be able to identify people that they can and would contact for support if they found that they were at risk of homelessness. If they had nowhere to stay, that they can immediately imagine this network that they created and remember which people in those networks could be a source of support. And I know Jessica and Shannon, you guys might have examples from the programs you've worked on.
Yeah, with the My Life program, we do what's called partnership plans. So we really sit down with sort of the allies that youth have identified in their network, and we want them to have a really concrete discussion with their allies and not wait until they're sort of, excuse me, in crisis. And so they're writing down and discussing things on this partnership plan around activities. For instance, I would have a place to stay if I needed that, or I might have money in an emergency, so that when that time comes, that you sort of know there's no ambiguity around that.
As a youth coach in class, I do have another example of working with the youth where it was coming towards the end of our coaching year. And because he was trying to break away from the DHS care system and reunify himself with his bio parent, there was a kind of a span in time where he was in limbo. And because of behaviors, the group home pushed him out, and the caseworker wasn't connecting him to another placement, and so he left. He spent one night on the streets homeless, and I have to say, I think with the intervention we worked all year, he identified his first goal, which we support any of their goals, as wanting to go home to his parents. And then, just as Jessica spoke to, we also set up a meeting and worked on a partnership plan, and he had named individuals that he thought were important to him and that people that would help him through tough times. So he spent a night homeless, and then my job as a youth coach was to remind him of, okay, so who did we talk about, and who do you feel safe calling, and who do you think can support you through this? And so he did access one of those allies, and they came and got him, and he stayed with them until DHS and the bio family could go to court and, argue that they wanted their child home with them, which is a whole nother long story, but he is home with his parents. For me, and from witnessing, and just from my own lived experience to many, many years ago in California, which is hard for me because I'm so much older now, and I still see the same things repeating themselves in terms of homelessness and not having a place to go and not having connections, is, I experienced homelessness myself, and I can definitely speak to it was definitely because there was just no other option. There was just too many interruptions. I was experiencing, unfortunately, more abuse in foster homes, and just I didn't even have an awareness of what resources there were, to the point where I spent most of that year on the outside streets because I wasn't even well informed of shelters and such, because I really had to protect myself. I was one of the younger people on the street, and homeless youth, as they spend more time on the street, there actually becomes some subgroups, and there's the senior homeless youth on the streets that you really have to learn how to navigate because you become territorial stuff, and the newer people. And I guess, to keep the story short, it's just from experiencing that and then working with youth who have experienced those times of homelessness, it's been really impactful to see what interventions can do when they really focus on growing that social capital or growing allies and networks that are going to follow through and be sustainable in the young person's life.
Thank you, Shannon. So going to the next slide, I think we're probably going to close with this so we have room for questions and answers. We made some policy recommendations. We have a couple more slides that are pretty dense and will be available in the download of the PowerPoint presentation from today if you'd like to look at those. But I think we'll stop here on practice recommendations. And if I could leave the audience with anything, it would be this, that I would encourage people to be asking these kind of qualitative or quantitative network assessment in practice. So even if you're not finding some way to use a tool to assess networks, that you're asking these questions of yourself and you're having this conversation with youth to help yourselves and to help you think in terms of this larger network, this larger context of support, and asking questions like, are there family-based connections that will likely be maintained? So separate from the question of whether the child welfare system is supporting those connections, are they connections that the youth is likely to maintain? Are they relationships that we need to be talking to the youth about to make sure that they're healthy and supportive, and if so, that we're supporting them in creating and maintaining those connections? Do youth and their informal supports rely on the caseworker or the foster parent as a connecting tie to help youth continue accessing services? So when the case is closed and the caseworker steps out of the picture, does that youth and their primary supports know how to contact mental health services, know how to reach out for housing services without having the caseworker or the ILP case manager as their conduit to do that? So imagining that network, if that one network tie disappears, does a lot of the interconnection in the network go away with that caseworker? Think about whether informal members are providing multiple kinds of support, and if possible, encourage them to provide, if there are positive relationships that are sort of focused on one thing, see if you can focus them on some other things. Work and mentor the natural mentors if they're available in the networks to create new activities, new ways they can support youth. Are there family members providing concrete support? The literature is very clear that it tends to be family members that provide that kind of emergency support. So whether we're talking about actual biological family, former foster family members, are there people the youth considers family that they'll look to? Is there compositional diversity in the network? And that includes parent figures, service providers, but also friends. Does the youth have a peer network? And Shannon, you might want to say something about peer mentoring.
Yeah, we just found that just through our studies, there's been Project Success, there's been My Life, Better Futures, and Now Futures. And right now, a few of our projects really focus on the near peer aspect of coaching or mentoring, as might be more familiar to you. And so then each person, so the person mentoring actually has lived experience in care. Like for Futures, our students, first-year students, will be mentored by junior or senior students who also have lived experience in care and lived experience with mental health stressors. And we found just through other projects that lived experience has been very important and very helpful. It also works two ways then, because both the near peer and the peer are learning from each other and growing. And it's been very powerful. I mean, maybe Jessica could speak more towards the outcomes we've seen from it, but it's something to really consider when you're doing this work, is really looking for the people that can relate and understand and have themselves been successful and be able to share that with the person that they're mentoring.
most important sort of piece for me in all of this too is to really think about the opportunities our youth have to engage. We have about a third of our youth in what I call restricted placement settings in the Tri-County area. So thinking DD placements, group homes, therapeutic level treatment, and those youth have been identified as having more need and needing more support. And what we've actually found is they have significantly less contact and engagement with the community, less access to telephone and internet, and these are all sort of traditional means of creating networks. And so when we're thinking about the group who actually needs more support and more access to building networks, we're really thinking about this group who's already going to have additional struggles around having a disability or a mental health challenge. And so how can we look at that group, a third of our youth, who don't have sort of traditional means of creating networks and access, being allies in their life? How do we give them actually more opportunities rather than fewer opportunities than our other youth are getting?
I just want to call attention to the time here. We're nearing the end of the webinar, and I just wanted to ask if we're ready to address some of the questions that have come across. All right, great. Then we'll turn our attention now to questions that we've received. The first one comes to us about to what extent has network intervention been utilized and evaluated for youth exiting juvenile or criminal justice systems, and how might it be different or the same from the foster care context?
As far as I know, there isn't much network intervention out there in terms of starting with a network assessment and focusing activities on those. I'm not familiar with any network studies for youth exiting juvenile or criminal justice systems. I think it's an area that's ripe for a similar approach. I think it would largely be the same for that population of youth, and especially since we know there are so many crossover youth that are involved in both systems. And in the end, we're talking about potential for disrupted networks and not having that stable home context to return to potentially. I would say that the approach and the thinking would be very much the same. And that's actually one thing that draws me to the network perspective and the network measurement approach is it's a way to think about the support foster youth or youth who have been involved in the juvenile justice system, or really any vulnerable youth that we know will have a variation of different challenges and strengths. It's a way to talk about how we support them that is consistent. If we know we want bonding capital and bridging capital for youth, regardless of what their individual circumstances are, we can develop ways to assess for those things and intervene on those things that are not so focused on what are the individual problems of the youth. We're not problematizing the youth, we're problematizing the network, and we're saying what, as an informal and a formal service system, are we or are we not providing to support these youth and maintain them and stabilize them regardless of what their individual challenges are, because we know across the board we're going to see youth experiencing those individual challenges. So really the larger question is, what can we as systems do better? And when we're talking about individual network intervention, we're asking the adults in those networks, the formal and the informal supports, what can they do better to communicate amongst each other, to stay connected, to monitor youth needs and resources? How do we recreate that family-like network functionality around youth who might not have that from their family of origin, potentially because they've been system involved?
Okay. All right. There's one question about the tools used being available somewhere. If Beth wants to write back in and just clarify which tool exactly, but I believe you have some reference slides, Jennifer, that will be available.
I'm guessing it's the social network tools, and yeah, if you download the PDF, you'll see in the references links to an article I just published a couple months ago in Children Youth Services Review that you should, if you have access to the journal, you should be able to download a version of the network measure. Anybody is welcome to email me. My email will be in the PDF, and I'd be happy to provide you a very simple version that you could adapt for yourself. It's just a Word document. the important part is how you're approaching it. It's not so much tool-driven. It's that you're starting with a map and you're starting with some way to ask about particular relationships. So I'd be happy to email that to anybody who contacted me.
Yeah, and again, this webinar is being recorded, and the PDF of the slides will be available on the Pathways RTC website, and that's pathwaysrtc.pdx.edu. We can have time for maybe one or two more questions. They're starting to come in here. Let's see. This one is coming in about how do you support the youth and their chosen system support when it goes against the agency's workers' recommendations?
So this is Jessica, and as I said, I was a former caseworker. I think it's really important to be mindful, both from the caseworker perspective, but other adults working with youth, that these are transition age youth, and that their chosen allies are going to be people who support them as soon as the agency is involved, and that's going to be really soon. And so I think what approaches that we do really in my life that work well is sort of really providing unconditional support around what the youth chooses, but really being mindful to teach them the skills how to make self-assessment for themselves about whether this person is in the best interest of their goals and is truly going to provide support. So sitting down with the youth and walking through pros and cons, being a caring person that says, what about this instance that could potentially be harmful? How do you work through this? Do we want to skill build around this? Or is this a person that we need to kind of work around setting good boundaries? And I think it's sort of putting in place all those pieces that the youth is able to navigate that ally as much or as less as they really want. And that we just really need to be mindful that the agency is in their life for a small fraction of their life. Let's give them the skills to choose and navigate the allies that are supportive to them in a larger sense.
Great. We've got about 3 more minutes left, so let's take one more question. How do you address substance abuse where the person may need to reduce their network in order to stabilize and move forward?
I think I read that question and I was thinking about just different experiences of thinking my internship with New Avenues for Youth many years ago, and then as a youth coach for my life, and working with young people in general. I think the first step is always important to meet them where they're at. So it's never been for me about intervening in the sense of making demands upon who they separate themselves from or what their step is. But again, it's more, I've always thought of it as more of a harm reduction model in approaching them. And really, again, working to identify, help support them while they identify their goals and help expose them to multiple experiences that they might not have. So building those skills and reinforcing that, their allies and how important that they are. And we've always had kind of the philosophy of we just give young people all the information they ask for, so information they haven't had access to. And then from there, we've often seen them make choices for themselves then to perhaps, get clean, separate themselves from maybe individuals that are supporting their drug use or supplying their drug use. Oftentimes, too, these young people that we've worked with, they also are experiencing mental health stressors on top of the drug use. So, again, it's a really hard question, and I think a lot of times the answers come from being very strength-based and very focused on meeting the youth at where they're at, active listening, and help them identify goals that will hopefully lead them to their own goal of not using substance.
All right, great. Thanks, Shannon. And the last question has come in. I don't know that we necessarily have time to do it justice here, but I kind of wanted to acknowledge it because it's an interesting concept. Have you reached out to public librarians as potentially being part of the social networks? Since many youth experiencing homelessness are using libraries as safe spaces, I'd be happy to talk to presenters more about this if they're interested. This is the work that I do. So I don't know if we have any quick reflections on that. Certainly, Julie, you're free to email the presenters that will be on the slides that are available. Any last thoughts about that or anything else?
I've never thought of that before, and that's brilliant. Thank you for sending in the question. It's something that I'll remember as potentially a resource it had not occurred to me.
Okay.
It's awesome. And that's what, I mean, I will say that one on our new project features with these these college-aged folks that are coming from foster care into college, we've reached out all across campus creating what's called like Campus Champions, so a sort of ally support system. And that person in our Portland State Library is also the librarian is going to be a champion. And just reading your question, I wish I would have thought of that as a youth worker, just how many times I spent in libraries with young people. That is, yeah, awesome, brilliant.
Great. So it would be great if Julie could just email you all. Okay, great. The slides will be available on the Pathways RTC website. And that is all the time that we have for today. So I want to thank our distinguished panel for joining us today, and I want to thank all of you out there for your time and attention, and we hope this was very helpful to you. If you have any other questions or issues, again, the slides will be available, and you can write into our panelists directly and address your questions there. So thanks, everyone, and we're going to be signing off now.
Thanks, everybody.
Bye.
Mm-hmm.